Taoiseach, I've been raising for years now the issue of specialist treatment for eating disorders. The news that no new inpatient beds for adults with eating disorders have opened should be surprising. But given all of the broken promises and missed deadlines over the years, how could anyone be surprised? But we should be, and we should be shocked. Shocked at the lack of urgency, at the level of mismanagement, shocked at the complete lack of help and hope for so many people who are seriously ill. Taoiseach, in 2018, when you were the Minister for Health, the HSE published a new national model of care for eating disorders. Under that plan, 20 new inpatient beds were promised. They were supposed to be delivered by 2023. To date, 0 have been delivered. Not only has there been an abject failure to deliver these beds, there hasn't even been an attempt. The Journal has confirmed today that no new funding was provided at any stage in the past 6 years to open these beds. Taoiseach, as it stands, there are just 3 public beds in the entire country for adults with eating disorders, all of which are located in St Vincent's Hospital. So that means that only people who reside within that catchment area can get treated in those beds. So 3 beds for the entire country, and most of the country can't use them. Taoiseach, I have to say it doesn't seem like the government understands how serious eating disorders are. Over the years, I've spoken to women who've been forced to speak publicly about what they're going through, to set up GoFundMes to get the care that they need. I've spoken to parents at their wits' end, watching their children quite literally waste away in complete disbelief that there's no support for them. I've spoken to people who work over in the NHS who are seeing Irish women coming over at death's door because they can't get the care that they need at home. That reality doesn't seem at all represented in the government's response. 0 funding to provide more beds at any stage in the past 6 years. Taoiseach, anorexia has the highest mortality rate of any mental health condition, and incidences of anorexia are rising. In 2022, emissions were the highest in a decade. And yet when people are at death's door, when early intervention obviously isn't an option, there is nowhere for them to go because the beds don't exist. Sometimes the HSE will pay for private treatment for people, sometimes it won't. There's no clarity, no transparency around how those decisions are made. I want to acknowledge that there has been some progress with regard to care in the community, but we know that many people are far past the point of needing that early intervention. It's not an option for some people. People urgently need inpatient care. So Taoiseach, 20 new inpatient beds for adults with eating disorders was promised in 2018. When will they be delivered?
Thank you, Deputy Cairns. Taoiseach, please.
Well, I want to thank Deputy Cairns for raising this issue and acknowledge that it's an issue she raises on a regular basis and quite rightly. And I do want to assure you that I wish to show commitment to enhancing specialist services for eating disorders, including improved access and including shorter waiting lists. And I do accept that this is an issue in every community right across Ireland. Historically, I'd also agree that there has been a lack of publicly funded services for people with eating disorders in Ireland. We're coming from a very low place in terms of a record of investment, but I would point to the fact that the new model of care for the National Clinical Programme for Eating Disorders in 2018, as you've referenced, does mark a very significant milestone in terms of having clarity around how we intend to deliver and design our services, and indeed, absolutely, a list for government in terms of initiatives that need to quite rightly be funded. Research does show that the most effective treatment setting for eating disorders is in the community. I'll come back to the point you make about outside the community in a moment, but because it is right to say that a small number of people, mainly with restrictive eating disorders, will require inpatient care for stabilisation and indeed for other reasons. But 90% of eating disorder services are delivered within the community. The HSE does work hard to meet the needs of people with eating disorders in the setting most appropriate to their needs, whether that be the community eating disorder teams, beds in the public system, or indeed, as you've acknowledged, specialist beds from private providers funded by the HSE, or on occasion treatment abroad scheme, but we need to definitely be in a position where we can move away from that. Based on multidisciplinary community teams, the National Clinical Programme for Eating Disorders is now being implemented on a phased basis across the country. There are now 11 teams in place, 6 adult teams and 5 child and adolescent mental health service teams. 6 of these teams only started last year. So I suppose I just would slightly push back in terms of the lack of progress. We did start 6 of these teams in the last year. More than €8 million has been allocated to the National Clinical Programme since its establishment. About 100 posts have been funded through that programme. We now live in a country where there's 80 eating disorder clinicians, a little over 80 in fact, including 10 consultant psychiatrists. Adults who have an eating disorder diagnosis and require inpatient care can be referred to any of the HSE's acute inpatient mental health approved centres around the country. Eating disorders do affect a relatively young section of our population disproportionately, and there are currently 20 dedicated eating disorder beds across the 4 CAMHS inpatient units. As of the 23rd of April, in relation to that list, there was nobody waiting for access in that area as well. Access to services is increasing, twice as many assessments conducted last year as the year before. That's 449 assessments versus 227 as well. As part of additional funding secured under the last budget, a number of new posts will now be available to support youth mental health service provision and development, and this does include new specific posts to support eating disorders. Specifically though on St Vincent's, for adults requiring inpatient care, CHO6 does have the 3 dedicated beds for eating disorders based in St Vincent's. The need for additional inpatient beds has been identified. The Deputy is entirely correct in the model of care and in other policy documents. A recent HSE mental health bed capacity review did include eating disorder beds, and it is intended that a number of dedicated adult beds will increase in line with the model of care recommendation to get us to 20 adult inpatient beds.
Taoiseach, Deputy Cairns.
Taoiseach, like I said, I do welcome the opening of the 11 treatment hubs. Care in the community and early intervention is obviously hugely important, and I acknowledge that. It's not what I asked you about, but on that, we're missing the target there too. 16 treatment hubs should have been opened by 2023. So treatment does remain a postcode lottery. And it's not just adult services that are at breaking point, it's the adolescent ones too. So in some areas, 45% of beds are actually empty. And according to the Psychiatric Nurses Union, the HSE's own recruitment embargo is the reason for that, because there simply isn't the staff for them. So just on that, I suppose, is the government's plan to lift that embargo to address that issue? But Taoiseach, back to what I actually asked you about, more desperate than that situation is the issue with inpatient beds for adults. You acknowledged that we need them there. There is no funding allocated. So can you tell us when will funding be allocated, and when will we actually see the delivery of those 20 inpatient beds for eating disorders?
So I do fully acknowledge there is a need to get from 3 to 20, and that is a statement of fact. That's government policy. It's in the model of care. It's in other policy documents published by government, and it's been endorsed, if you like, by the HSE mental health bed capacity bed review. What I did outline was this year the area of priority in terms of additional investment going into this area is around some of the youth mental health and the CAMHS provision. I can send you a note on what we intend to get done this year. I did think it was interlinked to make the point in relation to at the CAMHS level, we do have the 20 beds across the 4 areas, and as a result we had zero, and as a result we had 0 people waiting for a bed yesterday. So I do just need to say that. In relation to the issue of the direct answer to your question is we need to get from 3 to 20, and I do intend to make more progress on that in the budget. In relation to the piece around recruitment, like all of this has to be seen in the context, and sometimes the debate in this House is a little bit skewed. There is not a ban on recruitment in the health service. 2,200 more people net will work in the health service, and probably more, but 2,200 more are funded at the end of this year than last year. That's true. That doesn't include disability services. It goes up to over 3,000 if you include disability services. And of course, within that budget, the HSE does need to make decisions as to where to direct that investment on the front line, and I'll specifically talk to the Minister for Health around the importance of this area.